Three, two, one. Hey, everybody. Good evening, Nancy. How are you?
Good. How are you? Happy Thanksgiving.
Good. Happy Thanksgiving to you. It's a couple days away, and got any relatives coming into town?
They already all live here, so
Okay. Okay. Good. Good.
right.
I've been hearing a lot of complaints from people that they're having to go to the airport today,
Mm,
and they're not happy.
yeah, I wouldn't be either. I'm glad I get to stay here.
Yeah. Yeah. Absolutely. So that's a double-edged sword sometimes because you live right in the belly of the beast, really near Chapel Hill, and we're going to be talking about UNC health yet again. So there's been a very big uproar again that they've got a program. I'm going to put it up right now that seemingly kind of alerts parents, but doesn't actually about a teen. And this is really kind of outrageous about a teen advisory board with the health equity program.
Mhm.
And it says here that, there's some things sent home with the parents. Maybe they don't see it with the kids, but it's for contraception. So teens are being recruited from school, Orange County, a couple more counties, Durham, of course, usual players, to participate in a really what it looks like to me, Nancy, is a study. Tell me about it.
Yeah, well, it's under the UNC School of Medicine. So the department, this Office of Health Equity Research, is funded by the School of Medicine as part of the School of Medicine. And they are recruiting minors in high schools through the public school system. Um, they are recruiting minors and paying them, reimbursing them $250 worth of gift cards to help advise them on ways to educate teens about contraception and all of that. They're specifically targeting females, although it looks like they're including uh, potentially males, I guess, as trans females as well. It's very confusing.
Well,
To,
they can be pregnant, right?
I
Maybe.
guess to sign up, you take surveys, including gender theory surveys, gender identities, all of these things. You don't need to have parental consent, it appears, based on the surveys and the sign up forms. And you get paid if you go to a Zoom meeting a month or so. To me, this is egregious. Again, it's behind the backs of parents, essentially, since you don't need, appears, parental consent. They are paying students. They're taking surveys about their gender identities, again, inserting gender and queer theory into young minds, and then asking them about, sexual practices and how to learn about contraception and all of this stuff and paying them for it. This is the UNC School of Medicine doing it, and they're doing it through schools, public schools.
Yeah, they are. So, we keep talking about this. There's some need for radical individuals on university campuses to have access to our children, whether it's third party programming, whether it's the teacher themselves, whether it's the actual school district themselves. They want to get their hands on our children, and they don't really want the parents around. So this is another example of that. But look, you and I have been railing against a particular provision in the general statutes that gives doctors access to children from 0 years and up when it
Mhm.
comes to contraceptives, when it comes to curing drug addictions or treating them, also when it comes to mental health maladies. That would include gender dysphoria, depression, ADHD, etc. So through schools right now, until the Parental Rights Act goes into effect in January, through
Mhm.
schools, these providers, it's like shooting fish in a barrel,
Yeah.
right? You put these clinics inside of schools. They have unlimited, unfettered access to our children. Nothing's stopping it.
No, and they're paying these kids to do it. So why wouldn't a kid sign up? And then they're introducing queer theory. They're introducing race theory through intersectionality and queer theory, having secret Zoom meetings, all funded and supported by the UNC School of Medicine under Dean Wesley Burks and Vice Dean Christy Page. It's evil. It's malicious. I was beside myself today reading the story, broken by a citizen journalist in Orange County, and it's disgusting. It's absolutely disgusting. The leadership at UNC is off the wall. I have no other words for it. I've railed against them before, but really this time there are no excuses here. This is, and if you research the Office of Health Equity, the center, whatever, under the UNC School of Medicine, it's just as disgusting, and it's not a surprise why they're doing this.
Let me tell you something. The country is out of control. Every single institution is out of control. But when we have the marrying of CRT and queer theory and Marxism, really, in healthcare, we have a red alert situation. So we've got trustees who are sitting up there who could do something about this. These are trustees. My understanding is that most of them have been appointed by Republicans, right? So our own party. They're sitting there. They're either doing very little or nothing at all. The time for phoning it in has far eclipsed. We're done. We're at red alert.
Yeah, I'd ask any trustees who are interested in phoning it in, or who are interested in saying, well, we can trust the people underneath us, which I've heard them say at meetings, to step aside and to step down. It's time to step up, be the adult, do your job, get rid of these malicious programs, and just quit the nonsense. It's disgusting on public taxpayer dollars. It's gross.
Yeah, I mean, we're hanging by a thread. So speaking of UNC, it looks like the chancellor, it's not clear whether he's being forced out or if he's leaving on his own or whatever. The material fact, though, is he is leaving. And I believe, again, we're left with the leadership in the General Assembly to have to lean on the trustees and the Board of Governors to do the right thing and to appoint the right type of chancellor. This place is out of control. You've got the craziest people, the most radical people on planet Earth running the asylum over there.
Yeah, it's terrible. And again, I think that Dean Wesley Burks and Vice Dean Christy Page, who's behind a lot of this stuff and who cannot step into the ultimate dean chair of the School of Medicine, they both need to follow Kevin Guskowitz and not let the door hit them on the way out. If they can't control this stuff, if they can't step up to the plate, if they can't watch over their programming, and they're leading all these ideological bureaucracies in medicine and allowing it to flourish, then they're not the right people for the job. They need to go.
Well said. Well said. This is theoretically the crown jewel of our public university system here. It's got to be controlled, period, end of discussion. So look, this really pissed me off. As I was looking on the UNC Health Equity website, I came across the first link that I chose. It's health narratives. Okay. And we click on it. I'm going to put it up here right now. And it's from the AMA, and it is advocating a totalitarian system of communication. Why narratives matter. Dominant narratives, whatever the hell that is called malignant narratives about race, individualism, meritocracy. So I believe that means, let me see, dominant. It would be Jewish for sure, white for sure, probably Christian for sure, right? Male. And that's called malignant. The AMA. Now, this is a radical organization that many Americans really believe controls the lion's share of doctors. You're a doctor. Tell me about the AMA. What's your view of it?
It's a collection of physicians who buy into it. I don't know that the majority of physicians even want to have anything to do with it. It's just another association, but it throws its weight around, and is basically acts like a teachers union, but for doctors. So a lot of individual doctors, and I encourage you to go, when you go see your doctor, any doctor, specialist, your primary care physician, whoever, to ask if they're members and what they think of it. I have never been a member of the AMA. I get their flyers in the mail and I rip them up and throw them in the garbage. I have no interest in that organization whatsoever. But, these institutions find something bolstered, or their ideology bolstered by a medical association, and immediately throw it up there to bully the student or the patient into saying, well, we're the experts. Here is a group of doctors, even though it's, basically a small group of ideologues pretending to be doctors. And what they say is fact, when quite frankly, it's not. That's what the AMA is.
It's bullshit. And I'm going to evidence that by the next thing I'm going to read. Let me put this up here. Here's how they describe whiteness. It's let's see, the power and privileges that people are defined with as whites receive whiteness in this way is both cultural and socioeconomic power, privilege, blah, blah, blah. Political significance, everybody else is compared to that norm. It is complex and debated term, full of paradox, etc. No, it's not. It's open your eyes. Someone is Caucasian, for gosh sakes. How hard is it? So I know what they're getting at here. I mean, this is demonizing white people.
Oh, yeah. And they have it even more. The whole list of this Office of Health Equity Research, they blatantly come out and say, you know, I've known their health equity program is based on critical race theory and white privilege from public records previously received, where they have internal presentations and they say directly as much. This website publicly proclaims it. Their whole list is critical race theory resources, whether it's the 1619 project, which is directly on there. There's Delgado and Stefaniak, some of the founding, you know, ideologues behind critical race theory, their work. There's the White Fragility book. There's Ibram Kendi about 4 times over. There are anti-racist clubs that are recommended on there. Black abolition resources and liberation, which is a term that basically means communist. All of the white fragility, I think I mentioned the 50 ways of white privilege, the Peggy McIntosh backpack thing. Health equity is critical race theory. It is. They say it internally and they say it explicitly on their websites. And this shows it, and it needs to stop. It's a radical theory that has nothing to do with facts and evidence.
Right. And it's terrifying that it's in healthcare. And again, you know, one of the 2 research institutions in this state, it gets the lion's share of the budget. I mean, the budget is out of control with the amount of money that they receive. There's a new project to fund a UNC and ECU combined psychiatric center for youth. That scares the hell out of me. I do not know why one Republican that I know of stood up and said, you know what, I'm going to be a stickler. I'm not going to vote for this budget because of this money that's going into UNC. And just look at the website. If the website says this, look, people, this is the forward facing calling card of not only the medical school, but the biggest healthcare system in the state of North Carolina. I do not hear enough lawmakers standing up and out against this.
No, and it's what health equity is. It's critical race theory, and the bureaucrats and the ideologues and the dean of medicine, the vice dean Christy Page, will come out and say, "Oh, we're just trying to close gaps. We're trying to make things better for people who are underserved." No, no, no. This doesn't close gaps. This widens gaps. This makes things worse. This causes division. This causes resentment. The white privilege crap. I mean, that was motivation for a shooter to go in and kill 3 innocent babies at a private Christian school.
What about that
governor manifesto?
What about the 15-year-old? Yeah. It causes murder. So now, you know,
kills people.
3 years ago when we started out with this, we you know, kind of soft pedaled it because I don't think we wanted to believe, you and I wanted to believe the dangerousness. CRT causes murder. DEI causes murder. I mean, be it a willful negligence or October 7th in Israel. It causes murder. It's no different from what the Hamas teaches their children at 3 years old, which is the entire point of me getting involved with this project, because I knew immediately when we saw that curriculum, wow, we're in trouble. Then you discovered that it was in the medical community here at UNC specifically. So I mean, we know that it's everywhere. We've been talking about this, but now it's time we talk about a way out, a way forward, and to put pressure on lawmakers. Look, they're running for office now. Now's the time to not only get them on record, but get them to volunteer their solutions on what will stop it. You know, I heard a great interview today with Ted Cruz about a new book that he has. I believe it's the end of wokeness, whatever.
Yeah, I think it was on Bill Maher recently too, or something.
It was, yeah.
Yeah, and even he went over Bill Maher a little bit or something. I don't know. I didn't see the whole thing.
But Bill Maher's been making hits lately, to be honest, in my opinion. But the book proffers a few good solutions to this. I think obviously the obvious right is defunding. I mean, that's the top mechanism. And the
totally do.
Republicans won't even do that. Republicans, why am I picking on you? You're in charge right now. You have to do more than rail against wokeness. Now, I'll say some good things have been done during this legislative session, like stopping the predatory behavior of transing children that are 2, 3, and 4 years old. But we hadn't gone far enough.
Mm-mm. No, this thing, I mean, when I saw it today, and it's been in existence, it looks to me like it came around mid 2020, like the intersection of COVID and George Floyd, based on going back to the web archive and some of their documents and everything. But it is as radical as anything, and it is under the School of Medicine. This is not public health. This is not global health. This is not the School of Social Work. This is not the undergraduate. This is the School of Medicine. It is disgusting. It is malicious. And I call out the doctors who support it. And I call for an end to this Office of Health Equity Research. It is ridiculous.
Oh, now that you just said that, that's a tangible ask. We can ask. Yeah, as soon as the legislature gets back in session, I believe it'll be May. Unfortunately, that is forever. We need to do away with it. We need strong voices.
Why would you need it? You already have these DEI. I mean, this is separate from their DEI programs. Like you have
no, it needs to close.
It's a whole additional aspect of bureaucracy. It's radical. It's unbalanced. It's completely biased. It's political, and I have no interest in having my tax money funding it under the School of Medicine. It's insane.
But I just read to you, it has nothing to do with equity, because if equity is fair for all.
No, it's all CRT.
Yeah. The one definition I gave you was whiteness, and while that is bad, so that's by definition is not equity. It's on their own damn website.
Yeah, it's on their own website.
Yeah, equity means racism. It means that.
Mm-hmm. And it's on their website. It's right there. And not only that, but in practicality, now we have evidence that they're using that Office of Health Equity Research and closing gaps, so they say, to go behind parents' backs, again, in schools, targeting children to fall under their ideology. It's disgusting. It's malicious. I can't say it enough. Gosh, I'm going off. I was really upset today. This one, just can't take it anymore.
I think we invented a few new cuss words today.
Yeah.
On the phone?
I did. Yeah. I try not to do it on video.
Yeah, we try. I think I'll let a few slide here, because I'm tired of talking the same thing. I mean, you guys have to be tired of hearing it. We're tired of talking about it, but we're not going to not talk about it because it's actually happening. That's what they want. They want to wear us down, Nancy. They want to wear us down. They want to keep doing this stuff. They want to keep pushing, right? And they think, oh, people are going to get sick of hearing it. Well, sorry, I'm not going to get, I'm sick of talking about it, but I'm not going to stop. You're not going to stop. We're not going to stop.
It's more evidence that these doctors in the leadership position are not doing what they're paid 6 figures and 7 figures to do.
Right. Exactly. And we're going to stay on their ass. I mean, we're not going to stop doing that. So once again, I'm going to put this story up here for you so you know where to get it. You know where to look for it. So the next steps are, I'm hearing, I'm not going to give any more information about it, but I'm hearing that there may be a lawsuit about this.
I've heard some talk about that, but I need to find out more directly about if that's really happening. But yeah, this is outrageous. UNC Health, stop it.
Yeah.
Just stop targeting kids. Stop lying about what health equity is. Stop your idiotic ideologue.
They're not going to stop. They're not going to stop until we stop them. Guys, they will not stop until we stop them. I'm telling you from experience, it will not happen. So they've got people that they need, and not all, I would say maybe 20%. They need to go. Their ass needs to go. And I'm telling you, I'm seeing a lot of people that are being fired. They're being canned. These same people we're talking about, I guarantee you, they're anti-Semites. They're the ones out there causing all these problems. It's the same crew. We're fighting the same crew. The same gender crazies are the same people that are out there ginning up support for Hamas and against Jews. It's Marxism, people.
Mm-hmm.
That's what we're up against.
And it's unfortunate because it shadows a lot of doctors who are really good and who hate this stuff. and
They
who
do.
want nothing to do with it, and who are part of the UNC system or part of the physicians network, like my own husband, who doesn't agree, who looks at this stuff and is like, what? Like, what the heck is this? And unfortunately, he's associated with it because of this. And there are good doctors at UNC, and their reputations are being tarnished by this crap because the leadership can't deal. And we're funding it, and it's so, ugh, can't take it.
How do we know there's great doctors besides what you just said? They reach out to us all the time.
Mhm.
They reach out to us all the time. They thank us profusely. They tell us not to stop. We're not going to stop. We are not going to see a once wonderful system being completely trashed from within. It's been 3 years of getting the hell kicked out of this system, and we're going to be part of the solution. We're not going to let it happen. So we're going to keep having these conversations. We're going to keep alerting you guys so that you know to look for, is UNC involved in my school, in my district? How are they involved? You guys, you need to really look. You need to proactively look. You need to go on record with the school in writing and in conversations, I guess, and say, I am objecting to this. They're not going to get their hands on my kid.
Yeah, and you need to talk to your kid and every day,
That too.
and talk to them. It sounds great from your perspective. It sounds like you're helping the world. And you get to work with, researchers and physicians. It just sounds so wonderful, and you're going to solve the world's problems. But that's not really what this is. And here's why. And you need to trust me as a parent. You need to have these conversations with your kids too, so that they know, because these people are professionals. They're handing out $250 gift cards to bribe your kid to go behind your back to talk about gender theory.
And God forbid, do something about it.
Right.
Because let me just tell you the law will be in schools now. Theoretically, there's going to be a law forbidding that, but in the state of North Carolina, I want to reiterate to all parents out there, anyone can treat your child for a mental health malady from 0 and up. In other words, they can consent to their own care. I've talked to legislators behind the scenes and lobbyists that say they have never seen anything like this with respect to getting legislators to change this law. They're experiencing a lot of resistance. I would imagine it's from the medical lobby itself, because why wouldn't you want to treat kids and just send their parents the bill? Right. But it's wrong. It needs to be changed. We're not at a time in this country right now where we can wait.
Yeah. This was very upsetting today, and I don't want to hear any excuses. I don't want to hear any "we're closing the gaps" BS. I don't want to hear it. It is implicit and explicit. CRT, health equity, is critical race theory and white privilege. That's what it is.
Period. So, well, thank you. It's been nice catching up with you.
Yeah, you too.
Again, about UNC Health. Have a wonderful Thanksgiving. All of you, have a wonderful Thanksgiving. There's a lot going on in the world right now, and we need to kind of have that in the background and have our family in the foreground.
Appreciate your family, and appreciate your friends that you have a wonderful time with, and cheers to them.
Well, thank you, Nancy.
Yeah.
Cheers to you.
Take the couple of days to appreciate the people around you.
And I'm thankful for you, Nancy.
Oh, thanks. I'm thankful for you too. So.
All right. Have a good night.
Yep. Good night.
Bye.
Bye.